Hello?
Hi, Papa.
Hi, can you hear me?
Yes, I can hear you.
It's good. Let me close my window. It's fine.
Yeah, we can hear you. Can you hear us?
Yes.
Yes, I
Hello?
can hear you.
Okay, amazing. Okay. So are we gonna start now or like in a few minutes?
We can wait a few minutes for
Who
more
is
people.
who is O triple S? Is that Yasmin?
Yes, me.
Oh,
Yeah.
okay.
We are like
Oh, okay.
the collaboration. Okay, cool. Thank you.
You can remind the participants. Yes, are you on?
Sorry, what was that?
Yasmin.
Hello.
You
Hello.
can put it in the WhatsApp group or something so that they know to join. We are starting.
Okay.
Papa, can you hear me?
Yeah, I can hear you.
Okay.
Okay, perfect. Nuran in OSSS, can you hear us?
Yeah, we can hear you. It's all good on this side.
Perfect. Shall we start?
Yeah,
Sure.
I'm happy to start.
Perfect. Rahba,
Let's go.
the stage is yours. Go on.
Has everyone come through? Have all the participants joined or not yet?
Yeah, I think most of the participants are joining in person, so they should be listening to us through the OSSS account. Is that correct, Nuran?
Oh, okay.
Yeah,
All right.
yeah, it's correct. I can open the camera, but I don't know if you can see us.
Okay,
Yeah, that
I'll
would be great.
open mine. Hello, everyone. Hi, I'm Rahba. I am a foundation year 2 doctor. I have a bit of experience in research, and I'm planning on sharing with you how to publish your first research. Just before we go ahead, I just want to know what the audience is expecting and what burning questions they have just before I proceed and start sharing my screen.
So from the ultimate side, we are most of like us as like second and fourth year of like medical students in Egypt. So we were trying to like start our journey in publishing, and like personally I'm having a lot of like issues with like choosing my journals, how to like have a valuable paper, and that is like to know like what I should do to get like a good paper published is like my goal this session, I guess.
Yeah. Okay, all right, that's fine. So what I'll do is I'll start sharing my screen. I think this presentation is more likely going to be a conversation than it is going to be more academic. I think for your level, so second year and fourth year level, what you need is mentorship. So you just need someone to guide the way and to let you know that, you know, it's not hard to get published. You just need to know sort of the tricks. And so I'll explain that throughout my slides. My slides are very to the point, so I'll be talking more than there is information on the slides. It will be more of me talking. So let me share my screen. Okay, I think I can. Yeah. Okay. Can you see my screen?
I can see your
Yes, I
screen.
can see your screen.
Okay, what about this? Can you see this as well?
Yes.
Yeah.
Okay. All right, that's good. Okay, so Bismillah. Okay. So this is my first publication. I did it when I was I think I was a fifth year medical student at the time. And in our university, which was the University of Khartoum, we had a whole year where the main subject was research. Actually, the main subject was community medicine. I'm not sure if you have it in your university, but in community medicine, there was the most important thing about the whole curriculum was to get a research done, not necessarily published, but to at least get a manuscript and to present it to the batch at the end of the year. So I have always had interest in, I'm not going to say research, but I've always had interest in reading things, in studying things, and or in analyzing things in my mind. كده. At the time, I had a bit of clinical experience in epilepsy, and it was specifically epilepsy in caregivers of children, يعني pediatric epilepsy. So I already had an experience in this area. So I decided instead of going for a completely different medical subject, I'm going to use the subject that I already have experience in, and I'm going to choose something very simple that I can do. And I'm going to go ahead, and my goal is going to be to publish a research. So it was my goal from the beginning. إنه أنا خلاص I have a clinical experience in epilepsy. I've been to this clinic before. I have dealt with parents of children with epilepsy. This is going to be my research, and I'm going to work on it with the intent of publishing. This is the most important thing. If you want to publish a research, number one, do it in something you're interested in, do it in something you have access to, and your intention shouldn't be doing it for the sake of doing it. No, doing it to publish. Okay, so this should be your starting point. By show of hands, what sort of clinical experience have you had that you think could be a good starting point for you to start your research in? Anything, any interesting case you've seen in hospital, any consultant that you've worked with, anything, anything like that?
I don't know exactly what to say. I feel like gonna specify like a certain disease. I'm a fourth year medical student. From my clinical experiences in the hospital, actually I'm volunteering in. Uh, I've encountered multiple patients like having pretty high blood pressure. Um,
Okay.
due to mostly patient unadherence to their medication most of the time. So I, that's what
Yeah,
mostly
that's
I encountered. So yeah.
yeah, that's excellent. So that's an excellent example. Like you can use that to create any kind of research topic that you want to create. Um, Essentially what you do. So for example, so your topic is non-compliance with medication in patients who are hypertensive. So what you can do is this can be a research topic. Class, you have the clinical experience. I'm assuming you have had contacts with consultants or registrars who would be willing to supervise you in that area. You can go on PubMed. You can so let's try doing that now. So if we go on, how do I? So if we go on PubMed and then we search hypertension and non-compliance, and let's see what, okay, this and medications. Okay. So if you go on PubMed and you put in these keywords, the keywords that I've put in, hypertension and non-compliance, let me put that as one word, and medications. And then you get all these topics. You have a research that was done on the burden and the challenge of treatment-resistant, oh, sorry, this is depression, controlling resistant hypertension. You have socioeconomic and behavioral determinants of non-compliance for diabetes and hypertension. You have this non-compliance to antihypertensive medication and its associated factors among hypertensives. So in your case, what I would do is I would open up this paper and I would have a look at the paper and I would see how they conducted this research. Just have a quick look. يعني see the study design, what design did they use, which patients were they encountering, what antihypertensive drugs were they specifically measuring, did they check the demographics of the patients who were non-compliant, were they old, were they young, what did the results show? So this is what you could, this is a starting point. Open PubMed, look at all, and it doesn't have to be one paper. You can start off with 3 papers. Try reading 3 papers on this topic. And then you start to get a feel of how these people did this research. And you're going to come to realize it's very simple. What these people did is they found the patient population. They spoke with these patients. They wrote down the data. They analyzed the data, and then they just put it in a very organized way. So going back to my slide, okay, going back to my slide, let's see what else I have on the, so now we know how to start. We're gonna go and we're gonna read the papers that we have that are related to specific things that we are interested in and that we have access to. تمام? طيب, before we start the actual process of research, the 2 most important things, or actually the most important thing in my opinion, is to have a supervisor. Very, very early on. This supervisor can be a teacher at your university. It can be a consultant in the hospital. So for example, the doctor that mentioned he went to a hospital where he saw hypertensive patients whose hypertension was not controlled. Look for the consultant looking after them. Tell them that you're interested in doing a study on this. For example, checking the number of patients who are non-compliant and checking how this is affecting their hypertension. Approach someone that you feel like will be helpful. Tell them that you are interested in doing a research on topic X and you would like them to supervise you. Supervision is important for ethical approval. If you don't have the appropriate supervisor, and that's usually someone who is senior, it can be hard to get ethical approval from a hospital. Or from a university. The second thing is seniors can guide you on the most appropriate journals to approach. It can guide you on the amount of patients that they want you to see and to take data from. And you would be able to regularly follow up with this senior with regards to your progress on the research. So this is the second most important thing. After you have your topic in mind, just go and speak to someone about it. It can start off with being someone senior at university who published before you. Ask them for advice. I feel like sometimes the best advice that you get isn't from senior doctors, but it's from senior people at university, because you both speak the same language, you both have the same interests, you both have the same amount of free time and etc. So sometimes the best advice that you can get from someone is from someone at your level, meaning someone who's still a medical student or someone who just graduated. They can give you a bit of advice, but professionally, it's important that you have a supervisor who is either a registrar or a consultant, so that they could properly supervise your research. And then obviously at the end, they would likely be a co-author with you in this research. For HOMO, when they do supervise you and they do help you in getting the ethical approval, at the end of the day, they know, by them being your supervisor, they will be a co-author in this research paper. Always make sure that when it's your work, that you become the first author and that nobody sort of bullies you into making them the first author, for example. People who work with you can be co-authors, but if you have come up with the idea and you have done the work and you have written the research paper, then you are entitled to be first author. Okay, so we talked about choosing a research cycle as a title. As I said, number one, it depends on not only your interest, but the resources that are available to you. If you're currently in a hospital where you are seeing a lot of diabetic patients, this is an available resource. Use this available resource to do a research on diabetes. And it doesn't have to be anything complex. You don't have to be talking about curing diabetes or curing cancer. No, simple. Especially as your first research, start off as something simple. When it comes to developing countries, any research that comes out of it will most likely be accepted by a very good journal because the number of researches that come from developing countries is very, very low. If you do a research on anything, not anything, لكن anything simple, it is most likely going to be accepted for in your countries. It is most likely going to be accepted by good journals because good journals do want more research from these countries. They want to know more about what's going on in these countries, and it comes from you. Okay, I think it's very good in you are developing this interest in research from earlier on, because as soon as you get the hang of it, خلاص, it becomes much more easier. As soon as you get your first research paper out, the second one comes out, the third one comes out, the fourth one comes out. It's all about starting, yeah, your starting point. As I said, interest, available resources, do something simple. Choose a simple title because if this is your first research, do something simple. Don't do anything complex. And the simpler it is, the easier the analysis will be, the easier writing your research would be. Okay? Okay, so when it comes to writing your title, so, for example, if we take the example of the doctor who mentioned the hypertensive patients, your population is going to be, for example, patients with hypertension in X area. You have to name the area or the hospital that you are taking data from. Which area, which hospital? This is your population. And مثلا the ages, is it an adult population? Is it a younger population? It's most likely going to be an adult population if it's hypertension. So in the title, make sure that your population is clear. Who is it? Or are we studying adults? It's most likely going to be adults. Which area of Egypt? Is it the whole of Egypt or is it a specific area of Egypt? Sometimes just saying Egypt is fine, just as I said in my research, I just said Sudan. I didn't specifically mention where in Sudan. You can go into more detail about that in the research paper itself. Talk about the topic. فأنت you are analyzing non-compliance of medication مثلا and how it's affecting hypertension in a population in Egypt. Okay? So this would be your title. Okay, we talked a bit about literature review. Literature review essentially means after you خلاص حاسس إن إحنا we have our topic, we have our title, we have spoken with our supervisors, we know who's going to supervise us, we've taken our ethical approval, and now we can start. So to start, we do something called literature review. It sounds scary, but it's essentially what I just showed you now in PubMed. You put in keywords, hypertension and non-compliance and medications, and you look up all the papers that you think are similar to what you have in mind. Choose in the beginning 3 to 4 papers, تمام? Just choose 3 to 4, read about them. You don't have to read them in much detail. You just want to know الفهم العام يعني. You just want to know, okay, which population did they use? How did they collect the data? What's the questionnaire that they used? What results did they come up with? Did they مثلا find out in their results that Those who were non-compliant were mainly the demographic who was 70 plus, and those who were more compliant were those ages 50 to 60. Have a look at the results, and it will give you an idea. The results in the questionnaire that these research papers use will give you an idea of what questionnaire you want to use for your research, what results you are looking forward to showing after you've done your research. So it will give you an idea. I know when I did my research, when I decided I wanted to do a topic on knowledge, attitudes, and practices of caregivers of epilepsy, I opened up a number of these papers. I think it was 3 to 4 in the beginning. By the end of, I think, 6 months, I had read around 20 papers, but not read in detail. I just wanted to have an idea. I was reading these papers, and from these papers, I was able to create my own questionnaire using ideas from these papers. I was able to understand what exact questions to put on the questionnaire, and I was able to figure out what I wanted to get out of this questionnaire. What results did I want to get out? In the knowledge, what kind of knowledge was I trying to analyze or research in my topic? What kind of attitudes was I trying to understand in these patients? What kind of practices was I going to ask the caregivers of these children? So the papers gave me an idea of how to formulate a questionnaire, and how to understand what kind of results I wanted to get from the paper. So this is essentially what I said. It matters because it gives us an understanding of what kind of research is already available. You obviously don't want to duplicate something that's already in the research. So if there has already been a research that has been done, for example, regarding non-compliance in antihypertensive medications in a specific area in Egypt, you can argue in no, and I'm going to do it in this different area of Egypt. So I'm not duplicating the same thing. The other thing that I didn't mention is you learn about their study design. It's my understanding that you were already given a few teaching sessions on study design, so I'm sure you're aware of the different study designs that we have. The study design that I used was the most simple study design anyone can ever use. And I would advise you, if this is your first time doing a research, is to use a cross-sectional study. A cross-sectional study, it's very simple. It's very easy. You are researching in a population at one moment in time. There isn't any follow-up. There isn't any complicated timelines. You just collect the data once, you analyze it, and that's it. And for a first paper, I think simplicity really helps. So try and be simple, especially in your first research paper. And a cross-sectional study design is what I used, and I would recommend you to use as well. There are easier researches that some people have done, for example, case studies, what else? Case series. I don't think I ever did a research on case studies and case series because I think it can be easier to do, but it can be harder for it to get accepted in a good journal because it's got to be a very good case study. Okay. The other very important thing about literature review is when you write your research paper later on, it helps as well, and we'll come to understand why. Okay, so we talked about this. Data collection. So for my paper, I used questionnaires. I know that recently with social media and WhatsApp and Telegram, people are using Google Forms. I don't like Google Forms because I think you don't really know what population you are targeting. You don't really know um, whether or not what people are writing is true or false. So I don't like them. I wouldn't recommend them. I'm not sure if you do a questionnaire using Google Forms spread out to different populations. I'm not sure if that would be accepted in a really good journal. So I would use physical papers. So I would go to this clinic carrying the questionnaires with me, and I would sit with each parent or father, and I would ask them questions using physical papers. And as I said, the questions that I got to create these questionnaires, I got them from the literature review that I had reviewed, from the papers that I had seen. I got ideas from them. Okay, so this is collecting data. And as I said, after I collected this data, okay, so I collected data on, for example, caregivers' knowledge about what they thought epilepsy was. Did they think it was something spiritual, or did they think it was an organic problem? For example, this is a question in the knowledge section. So in the results, for example, what I want to show is 60% of caregivers thought that epilepsy was spiritual in origin and not organic in origin, for example. The way that I would show this, it would be on a table. So I would show 60% thought this, 40% thought this, 30% thought this, for example. So this is how you show your results. I'll show you how I wrote it in my actual research paper in a bit. Okay, so now I've collected the data from these caregivers, or in your case, I've collected the data from the patients. Now, where do I put that data? So I have all these papers with me that I have used to ask all these participants all these kind of questions. So what am I going to do with the papers that I have? So what I did is I would put them in an Excel spreadsheet. I'm not sure if any of you have used Excel before. Let me see if I can. Excel. Okay, can you see my screen?
Yeah.
Okay, so in Excel, what I would do is, for example, I would put in caregiver 1. This is working. Caregiver 1. And then on top, I would put in knowledge question 1, knowledge question 2, knowledge question 3, attitudes question 1, attitudes question 2, attitudes question 3, practice question 1, practice question 2, practice question 3. So my paper assessed, as I said, the knowledge of caregivers, the attitudes of caregivers, and the practices of caregivers. So say, for example, for knowledge, I had 3 questions. I had, I think, 7 questions, but say I had 3 questions. For attitude, say I had 3 questions, and for practices, say I had 3 questions. So my questionnaire was in the form of yes or no. So do you think it's spiritual in origin? Yes or no. Do you think it can be treated / cured? Yes or no. This is me asking the caregivers. Do you think anti-epileptic medications work? Yes or no. In attitudes, I forgot the questions now, but I made sure that my questions were all yes or no, because it makes it very easy to analyze. So for example, I will say caregiver answered question 1, yes, answered question 2, no, answered question 3, yes, answered question 1, yes, yes, no, etc. تمام? And then I would do that for all the caregivers. So caregiver 2 said this, 3, 4, 5, 6, 7, 8, 9, 10, 11. Making sure that you don't obviously write the names of the caregivers because of confidentiality, etc. And then I would have a whole sheet. Sorry, did someone want to ask a question?
No, I didn't.
Okay, so I would have a whole sheet that had all the answers of the caregivers in a way that was coded. So I have caregiver 1, 2, 3, 4, 5, 6, etc. My study population was, I think I interviewed 100 patients. That was my study population. So I had 100 caregivers to put their data in. Okay, so this is how I organized my data. I used an Excel spreadsheet. The rows were the participants and the columns were the variables, as I showed you. After I was done with organizing my data, I exported it to an application called SPSS. Have any of you heard of SPSS before?
Yeah, I heard about it, but
It's fine. Easy,
when I tried
easy
to use it,
using.
I found it a little bit complicated.
Okay. Okay, all right. I think SPSS is one of the simplest applications for analysis, as far as I'm aware. And that's why I used it, because I had just started out. I knew nothing about analysis, so I just used SPSS, and I even learned how to use it from YouTube. So I would just open up like different YouTube sessions, how to analyze this, how to analyze that, how to check, how can I check the percentage of patients that said yes. I literally just opened YouTube and learned SPSS from YouTube, but the very like simple things that you can learn from YouTube. And I use that to analyze my data. If any of you have any questions about SPSS, I'm happy to try and go back to YouTube and have a look at the different ways that you can analyze data, and I'm happy to help. Happy to help anyone at any point during their research journey. Okay. So I exported all my data to SPSS, and then I analyzed my data. And I remember it wasn't rocket science, to be honest. As I said, I learned it from YouTube, and then it's just repetition. You're just doing the same thing over and over again. And then you get your results. So from SPSS, I was able to understand the amount of patients that said yes to a question, the amount of patients that said no to, sorry, caregivers that said no to a question. And I was also able to calculate this. I was able to calculate something called statistical significance. So one of the things that I wanted to do in my research paper, or something that I recognized along the way during my research, was that the caregivers of patients with generalized tonic-clonic versus caregivers of patients with non-generalized tonic-clonic, in my opinion, I started to feel like there was a difference in the knowledge and attitudes and practices between both caregivers. And so I wanted to check how significant that difference was. Was there a statistically significant difference between caregivers of patients with generalized tonic-clonic and those without generalized tonic-clonic? Or was it just a very mild difference that wasn't statistically significant? Statistically significant in lay terms means big enough to document. That's what it means. So for example, if you have water and you have a cup of juice, you will find that the glucose concentration between the water and the cup of juice is statistically significant, meaning there is a very huge difference between the two. And that is something that is important to document, especially for a research paper. So for example, if we're talking about the idea that one of the doctors said about non-compliance and in hypertensive patients, let's say, for example, you start to have a feel that those who are just diagnosed with hypertension are more, you start to feel that they are more compliant than those who have been diagnosed with hypertension for the past, let's say, 40 years. In SPSS, there is a way where you can see whether or not the difference is statistically significant, meaning there is a very, very huge difference between both populations, to the extent that it would cause you to document it in your research study. So there's a meaningful difference, okay? The more papers you read, As I said, in literature review, the more likely you're going to understand what statistically significant means, and the more it's going to be it's going to make sense. Okay. So now we're going to come to the last part of your research. So now you've had a title, you have a supervisor, you've gone to this clinic, you've collected the data, you've analyzed the data. Now it's about writing it for the sake of publishing. So now we want to write our paper. We want to write our paper so that we could send it to the publisher and get it published. And for me, this was the most fun part because all I had to do was just stay in front of a laptop and write. Like that was all. I didn't have to go to the clinic. I didn't have to speak with people. I didn't have to read any more papers. I was just sitting down and writing everything that I wanted to show to the journal that I was submitting to. Okay, so the research paper is divided into 4 parts. You have your introduction, you have your methods, your results, and your discussion. Okay, so let me go to my paper. I don't think I have. Yeah, let me go to my paper. Okay, so this is my introduction. So with introductions, it's important that you start off talking about, so an introduction is introducing the reviewer to your topic, okay? And it cannot just be, I decided to see compliance of hypertensive patients with regards to their antihypertensive medication. It has to be a story, okay? You have to tell the story of sort of what led you to do this research in a way. So for example, here I talk about epilepsy in children in general, okay? And then I talk about how I slowly narrow it down to Sudan, and I slowly narrow it down to why this study is important. So you've got to let the reviewer know why your study is important. So here I talk about epilepsy in general affecting children. Then I talk about how 89% of the burden is in the developing countries. And then I talk about how, according to the WHO, underdeveloped countries are not receiving effective treatment. And then I talk about how in Africa there is incorrect perceptions and stigma that hasn't changed. Despite the advancements. And then I talk about how it has been affecting Khartoum. And then I talk about how it affects family members. And I just go deeper and deeper and deeper. And at the very end, I tell them why this study is important. So I say identifying misinformation and misconceptions regarding epilepsy will help clinicians and health educators better understand what information to deliver to caregivers. But slowly in the introduction, you are going to, by the end of the introduction, the reviewer has to know that, okay, this is a research that I'm going to continue to read. This is a research worth reading, and it's a research worth doing. It's very important when you're writing your research paper that you always reference. So for example, here I say epilepsy is one of the most common serious neurological disorders in children, and it affects 0.5 to 1% during childhood. I have to reference, where did I find this information? Where did I find it? It has to be an eligible reference. It can't just be any reference. It can't just be, for example, ChatGPT or AI or Google. It has to be an actual reference. فهنا I put 1. Okay, as you can see, it's reference 1. When I click on it, I can see that reference 1 is an actual research paper written by this person, Shinar S. Pellock. Okay, the epidemiology and prognosis of pediatric epilepsy. So it's very important whenever you take whenever you write anything in your paper, you have to reference it with an appropriate reference. Okay, and these are usually papers that you're going to find on PubMed. And that is why I said the literature review or looking up papers is very important. And that's why I said by the end of my research, I found that I had read around 20 papers altogether, if not more. And I used these 20 papers to help me with my introduction, to help me with my writing, and to help me with writing the paper in general. Okay, so this is the first part of the paper, which is introduction. Now we're going to go to materials and methods. So material and methods is essentially, so tell us how you did your research. So that's essentially what it means. So here I say it was, this is a cross-sectional study, so I talk about the study design, carried out in this specific clinic, in this specific university from this time to this time. I talk a bit about the hospital. Um, I say that it's the only tertiary care pediatric hospital in Sudan. I talk about what the hospital, what kind of services it gives. I talk about who runs the neurology clinics and how many patients attend the clinic weekly. So I just give them an idea of the design and where I carried out the study. I then go into the participants. So who did I involve in my study? I involved caregivers, and these were caregivers that were recruited through this clinic, and they were all caregivers of children who were younger than 18 years of age, who had a diagnosis of epilepsy for a minimum of 6 months. So recognize how specific I am. So I didn't just say caregivers of children, and that's it. No, I told them what the age of the children was. It was younger than 18 years. And I didn't just say diagnosed with epilepsy. No, I said diagnosed for a minimum of 6 months. These were the people that were approached in the study. I talk about how many caregivers were approached, how many agreed to participate. So all of this is under participants. So you have to be very specific. The less specific you are, the more likely you're gonna get an email back asking a lot of questions. So who were these children? How long had they been diagnosed for? How many did you include? How many decided to not participate? So make sure that from the beginning you're very specific, and you're very comprehensive in everything that you're writing down. Instrument. So what did I use to collect the data? This essentially means what questionnaire did I use to collect the data? So I say data was obtained through a structured questionnaire, where the clinical parameters of the child with epilepsy were taken from the medical records. It was modified. It was translated into Arabic, then back to make sure that the translation was accurate. A pilot study was done. So a pilot study is a study that you do um, before you start collecting the data, just to test the questionnaire. So for example, when I started, I think I had 6 questions in knowledge, if not more. For example, let's say 6 questions in knowledge, 6 questions in attitudes, 6 questions in practice. I did a pilot study on 10 caregivers, and I decided that, okay, it was just a test. So I decided, okay, this question, there is no need for it. مثلا, caregivers don't really understand what this question means. Let's remove this question. This question, I'll add this specific terminology to it. And then you test your questionnaire with around 10 people. And after that, you create the final version of your questionnaire that you use on the population. Okay, so even in the instrument, I didn't just say I created a questionnaire about knowledge, attitudes, and practices, and that's it. No, be specific about everything that you've done and make sure everything that you're mentioning is professional and to the point and specific. So being specific is very important. Um, so this is the instrument. Okay. Yeah, so here I go into detail. So the knowledge section included statements regarding etiology, symptoms, seizure-provoking factors, um, attitudes and practice, yes and no, variety of answers. As I said, it was mainly yes and no questions. The attitude section consisted of 5 items. Each positive item awarded 1 point. Um, Yeah. Practices of, okay, so I just went specifically into how I created the questionnaire. Now talking about the analysis, I also specifically talked about, I told them that I used SPSS. I told them, I talked about the statistically significant component that I discussed with you guys earlier on. And I talked about the different types of analysis that I used to analyze my findings. طبعا, and looking at this now, I can't remember what this means because I did this a very long time ago, but it was one of the tests on SPSS that I did. There was the Mann-Whitney-U test, Kruskal-Wallis non-parametric. They sound scary, but they're actually, I remember they were actually quite simple to do. Okay, so this is the method, this is the material and method section. فحسن احنا we talked about the introduction. Material and methods section, I think if you do the study the right way, you won't have any trouble in writing your materials and methods. But hopefully if you have a supervisor at that point, they can help you. As I said, if the time that you are doing your scientific writing, you can always reach out to me and I'm happy to help as well. After the material and method section, there is the results section. So this is where you just talk about, so what did your research find? What did you find from your research? So for example, in my research, I found that the majority of caregivers were mothers. So this is actually a result. Most caregivers were mothers, 60%. This is a result that you can mention. I talked about the age of these caregivers, 39 plus minus 9.7. I talked about the employment of these caregivers. The majority were unemployed. I talk about who received university education, who was illiterate. These are all results. These are all part of the results. And all of these results are under demographics and epilepsy characteristics, so general results that I have found out. Okay. After I write this paragraph of demographic and characteristics, I create a table. And in this table, the table is essentially most of the things that I mentioned in the paragraph, or things that I couldn't mention in the paragraph, the reviewer would be able to see on the table. So I have table, the number of people, the percentage of people. So for example, 15.9% of caregivers were 20 to 29 years old. 12.1% were illiterate, 54.2% lived in the urban area, and etc. I talk about, we're still in the results section. So we started off with demographics, so general things about the research. My second part in the results is about the knowledge. So for example, we have most respondents stated that epilepsy is not infectious and that it is curable. However, 45.8% mentioned that inadequate sleep could not trigger the attack of seizures. So I talk about the results here. وطوالي after it, I have a table. So here, I have a table that has question 1, question 2, question 3, question 4, and the number of caregivers that said it's true, that said it's false, that said they had no idea. Okay, so you usually have a table that has everything, and then next to the table, there's like a little summary here. And I did the same thing for attitudes and practices. I wrote a bit about the practices, wrote a bit about the attitudes, and made sure I had it very clearly on the table. Okay. So these are what my tables looked like. Okay. Now we're going to come to the hardest part of the paper. So everything above was actually quite simple. It's not simple. You are going to have to work for it, work hard, but I would say the discussion is where you're going to have to really, really work hard on the discussion. So the discussion is essentially what you're doing is you are comparing the results that you have come up with from your research study to other research papers that you have read. That's why I said the literature review is very important. And it's important that you start off by reading 3 to 4 papers, but by the end, it's important that you read at least 20 papers with regards to the research paper that you want to do, because you're going to need these papers to help you in writing the discussion. The discussion is essentially you are discussing the results that you have come to found, and you are comparing them with all the other results that you have read about in different papers. So let's take, for example, let me see. Okay. So here, for example, when it comes to the general knowledge of caregivers in our study, only one caregiver answered all knowledge questions correctly. The level of knowledge of 41 caregivers was good, 63 was fair, and 3 was poor. The median knowledge score was 66.7. In comparison, so now I'm comparing it with another study. In comparison, Palestinian medical students reported a higher median knowledge score of 75%. This difference reflects the knowledge gap among our participants. So I found that the median knowledge score of caregivers in Sudan was 66.7. In another study, the median knowledge score of Palestinian medical students was 75. So I'm comparing it, but I don't stop there. I talk about what does this mean? What does this comparison mean? It reflects that there is a knowledge gap among our participants. That could be partially explained by the difference in education between medical students and the group of caregivers in our study. So I don't only just say, okay, we're 66.7, they're 75, but I talk about what does this mean? This means that number one, there's a knowledge gap. Why is there a knowledge gap? It could be because they're medical students and they've probably read about this and they know more from better than caregivers do, which is an acceptable way of explanation. And you will be expected to do this for, I wouldn't say each result that you have, but most of the important results that your research shows, it's important to compare with another one, okay? And to discuss this comparison, okay? So let's see, let's see. I'm trying to look for another one. Okay. Okay, let's see this one. In terms of practice, we found that less than half of the caregivers in our study rolled the child on their side during a generalized tonic-clonic seizure. In comparison, most of the parents, 71.5 in a study from Jordan, knew that lateral positioning is recommended when a child is seizing. So there's a difference. My study showed only 39.7 did that. But in a study from Jordan, 71.5% knew this was recommended. So I discussed this comparison. The former unfortunate finding reflects that most caregivers have a high chance of mismanaging children with epilepsy when they're in emergency situation. This indicates that healthcare personnel should focus more on teaching caregivers about first aid measures. Okay, so I'm comparing and I'm discussing this comparison. So this is why I'm telling you the discussion part is the hardest part, but I enjoyed it the most because I was able to make sense of my findings. So research isn't just about getting published to khalas. Research is about engaging with your research material. You want to engage with it. You want to communicate with it and you want it to communicate back to you as well. It's a form of engagement. And the discussion part was hard, but I enjoyed it because I was making sense of all the results that I was getting. And I was able to compare it with the different papers that I had read. And I was able to make sense of it and to see what sort of things we could put in place to improve the knowledge and improve the practices and improve the attitudes. The last thing in your paper is the conclusion. So the conclusion is bringing everything together. What do you conclude from this research? So I say many caregivers have significant misconceptions, poor parenting practices. It highlights the continuing need of education of caregivers, and it reveals that caregivers need training to fill the gaps and to minimize the stigma, sorry. You then have your author statement. So usually if you're a first author, you usually do most of the stuff, as you can see, or I did most of the stuff. And then here you have declaration of competing interests, meaning you just say that you don't have any competing interests. And then you have the ethical approval at the end, which I talked about in the beginning. You talk about where you got your ethical approval from. And then you have the references. So we talked a bit about the references. You're going to be using references throughout the whole of your research paper. So even in the discussion, when I talked about, for example, the Palestinian medical students or the Jordanian caregivers, I have to make sure that I'm referencing them. So for example, here, when I talk about Palestinian medical students higher median, I put the reference in Tawali. Where did I get this information from? Where did I get this information from? I got it from reference 26. And when you go on reference 26, you're going to find this is the research paper where I got that information from. Okay, that is why I say literature review is very important. Reading papers is very important. Okay, let me see if there's anything else. Yeah, so this is just conclusion of the presentation. As if this is your first research study, as I said, keep it simple. Use the resources that you have, enjoy the process, learn along the way. I did a number of research topics after my first one, but I would say that the one that I most enjoyed was my first one because I was getting to know everything from the beginning. I really, yeah, no, I really enjoyed it. I would say also, since you're medical students now, um, you do have the time to do a research. I think it becomes harder once you graduate. Um, and since I started working, it's become very, very hard for me to do research. Um, so use this time that you have as medical students to explore this part of research and this part of publication. I'm not saying it's impossible after you graduate, but I think you have more time now to read papers, to explore different topics, to engage in research, and you have each other as well to ask for advice. I'm pretty sure you have senior medical students and new graduates that you could ask for advice as well. So start now and enjoy the process as well. Research is actually very, very enjoyable. It's a very enjoyable practice. So yeah, so start small, be consistent, don't overthink. Publishing is much more simpler than you can imagine. If you want to make it complicated, it becomes complicated. But if you want to make it simple and to the point, it will be simple and to the point. Okay? Okay, I think that's the end of my presentation. I'm gonna stop sharing. And I'm happy to answer any questions.
So actually, we have a question. So I hope you're doing well. Thank you for your effort doing all that. I just published my first research. We're in the publication process. We didn't publish it yet. But we had a supervisor, and he had one condition to supervise us. He said that he just doesn't want to be associated with our paper, and he doesn't want to be a co-author. That was his condition. And what I usually hear is usually the opposite. So I just thought that was kind of weird because maybe if he's going to be associated or co-authored, then he's going to be more keen that we're not going to fall into any trouble or do any mistakes, and that his supervision is going to be of most help for us. So I just want to make sure that's normal, because
generally, I wasn't really satisfied with his supervision. So.
Mm. Yeah, I think it's odd because usually people would want to be co-authors in researches. So I think that's really, really odd. Um, I'm not sure. Do you know why he said that?
I don't know, but our group leader said that said that this is like he defended him using that. He said that if someone was to supervise a beginner group, then he doesn't want to be associated with that beginner group. And if he said otherwise, then he's just like using us and using our efforts. And I didn't really buy that, but I worked nonetheless. But I realized the more that I worked, that our group leader would come up again and again to us and tell us, "Hey, we worked, we did that mistake, and we're gonna go back in our steps because we just did that mistake." And so I wasn't really satisfied with that.
Hmm. Um, so I think it's one of two things. If we do have good intentions in how we look at it, it can be because he doesn't want to use your work and maybe he doesn't want to be a co-author in something that he didn't really put in a lot of effort in. But if you want to look at another way, could it be that, for example, there's something in the research that was done that could have been dodgy that the reviewers might look at and say, why was this done this way? Could it be that ethical approval wasn't taken in the right way? He's afraid that the reviewers would um, pick up that mistake that was done in the research and come after him as the supervisor.
Thing is, I'm not sure because I was just included in one part of the research thing. I was doing the screening along with some other team members, and that was basically my role. So I'm not really sure about the ethical part. I'm not sure about the any other things. So I'm kind of
Mm.
worried, and I'm just like very paranoid that some mistake is going to be there in our research paper. And this is my first one, so I'm kind of scared that it's just going to ruin my reputation from the get-go.
Yeah, to be honest, I'm going to give everyone an advice from here. It's very important that when you do a research that you make sure that you are doing it the correct way. You don't really want to be involved in a research that is done in a way that isn't correct. Um, yeah, so I just if you feel like you're not comfortable in being a part of this research because there is a potential chance that there is something done that wasn't done the right way or there's something dodgy about the research, I would just not be in the research paper. Um, so yeah, so whenever you do publish something, anything that has your name on it, I would be very cautious in making sure that it was done the right way before putting my name on something that I'm not 100% in agreement with.
Okay, so am I in just a risky place right now? I tried to get some
I mean,
advice at
I
that
don't
time.
know. Probably try speaking with someone in the team that you trust, and maybe you can go through the research paper together and you can see if there's anything, that you're not happy about. You can discuss it with the group leader, and if you feel like you're still in disagreement with them, then you don't have to be a part of it if you don't want to.
All right, but I already submitted my work. Like my screening process, everything is just in the publication process.
Okay. Um, I mean,
Just like go up and yeah.
probably this, I think that should be more of a team discussion. So probably discuss it with someone in your team that you trust. And if you feel like you don't want to go ahead with it, you can always cancel the publication.
All right. Okay. Thanks so much for your efforts.
You're welcome.
That's it. Thank you.
You're welcome.
Um, okay, so we have just one more question. We were wondering, do you have any tips for choosing our supervisors to like be with them? Is there like a certain type that we should pursue for like the supervisors, or what do you think of that?
So the supervisor that I chose was a consultant that I already had a good sort of relationship with professionally. And they also happened to be neurology pediatric consultants. So for me, that was the best supervisor that I could Like I didn't even have to think about it too much. So I think you will have a feel of whether or not this is the right supervisor for you, if it's in the same area that you are interested in, and if they're in general just nice people you think would be able to supervise you well throughout your research work, then I would just go ahead with them.
So that's it from our side. So like, thank you so much for the session. It was really amazing. Thank you.
You're welcome. You're welcome.
Thank you so much, Rahba. That was really, really beneficial. Thank you so much. I have one question, if that's okay.
Yeah.
I wonder if you have any advices for first-time researchers. How should we choose our first journal, considering the acceptance rates and the fees as well, and any hidden costs that may
So
come
I
on the
think
way?
for low developing countries, you don't pay. So for my research, I didn't pay anything. For developing countries in general, I don't think you pay. So I don't think you should worry about the whole payment issue. I think when you submit to a journal, you just say you're from this specific country and then you wouldn't have to pay. Choosing the journal, this is why I say literature review is very important. The choosing the journal depends on the paper that you're doing. So if you're doing a paper like mine, you have specific journals that you would be targeting. If you're doing a paper on hypertension and diabetes, you have specific papers that you'd be targeting. So I think after you do your literature review, when you look up the papers, when you read the papers, you will have a feel of the good quality journals and you will have a feel of the low quality journals. And then you can always discuss with your supervisor what would be the best journal. But it's important that you make sure that the journal that you are choosing is PubMed indexed. You don't want a journal that isn't PubMed indexed. So choose a journal that's PubMed indexed, and from the literature review, you'll just have a feel of which one is a high quality journal. And Google can always help you in assessing which one is high quality from which one is low quality.
Perfect. Thank you very much.
Okay, you're welcome. Take care, everyone.
Any questions, anyone? We're all good? Okay. Thank you very much, everyone.
Thank you.
I
Bye.
hope you enjoyed this session. You'll find in the chat box an evaluation form, so please just fill it. Yeah, thank you. Have a good rest of your day. Bye-bye.
Bye.